You mentioned a couple of other occupations and a couple of other degree programs, but I want to take a little side jog here for a second and just ask you a little bit. Of course, the Urban Health Program is dedicated to making sure that we have a culturally diverse healthcare system, that the healthcare providers come from all kinds of different backgrounds and cultures, and typically minorities, blacks, Latinos, Native Americans have been underrepresented in many of the health professions. Do we see that in the applied health sciences as well? And if so, what can we do to address that, do you think?
Yeah, absolutely. Our college, all of the programs in our college are concerned about the underrepresentation of certainly those groups and a few additional groups. But those in particular, and we recognize the importance of having professionals who look like the people that they're treating, and we value that. And so we do, through our college, through our urban health program, but also through our individual departments, we do seek to recruit and to admit diverse students, and to be supportive of you when you come to this program, so that you do succeed and that you can go out and serve very diverse populations. We think that's very, very important. Most of these programs are I'm going to say this, unfortunately overrepresented by white people, white middle class people, and so it's very, very crucial that we recruit people, and that's why a show like this is very important, because we want you to know about these programs. If you know about them, you can prepare yourself to apply for them, and we would love your applications to these programs.
Well, then that leads to the next obvious question, which is, what can people who might be watching, people who are inspired by some of the things that you've talked about, some of these professions that maybe have caught a viewer or a listener's ear, what should they be doing as high school students? What should they be doing as middle school students? What should they be doing as career changers, if they're interested in pursuing a degree that would lead to one of these careers?
Good question. Most of our programming are science-based, though not all, but most are. So my number one recommendation would be to start to take those science classes in high school. The math and science needs to start at that level. It's tough to pick it up when you're in college if you haven't been introduced to it in high school. That being said, if you're a career changer, it doesn't mean that you're not capable of picking it up.
Right.
But if you're young enough and you're watching this program and you're in high school, you want to take those courses. You want to take them seriously. You want to seek them out. They really are the foundation of becoming a health professional. It does start in high school, and you want to do well in high school. And then when you get to college, typically you're looking for undergraduate degree programs that tend to be science-based. Kinesiology is certainly a good one.
Sure.
But there are others. Things like biology, psychology are very good majors. Actually, things like anthropology link very, very nicely with any of the health professions, because they're looking at the human body, but they're looking at it from a different perspective.
Sure.
But I also want to send the message that if you want to major in English and still apply to a health profession program, you can do that.
Right.
So when you're in college, in order to apply to a health profession program, we will each have a number of required courses that are basic science courses that you have to take in addition to your bachelor's degree. And so you do have to keep that in mind. So we prefer science majors, but you do not have to major in a science program.
And I don't want to get too far away, because we've only got about 5 or 6 minutes left. The time just flies.
It does fly.
So could you, I don't want to get too far away from our very first conversation. What are some of the other degree programs that you had mentioned? Let's make sure we describe all of them, so that folks know what's out there for them.
And I do want to speak about a few of the others. Another very science-based program would be nutrition. We have a bachelor's degree in nutrition, and there are 2 tracks. You can just get nutrition sciences, where you learn about nutrition, and then it might be preparation for you to do another degree, a medical degree, a dental degree, some of the other degrees that are talked about in this program. There also is a nutrition program where you get your clinical training where you can go on and become a dietitian. But separate from the medical-based programs, we have a few others that are not so medical-based. We have master's degrees and PhD degree programs in disability studies. And these are wonderful programs if you're interested in maybe the social and political aspects of supporting people who have disability. We have a series of programs in health information management, and these are people who...
A very hot topic.
Very hot topic, and hot
Sure.
jobs, very hot jobs. There are both bachelor's degrees for those of you who are finishing a bachelor's degree, or if you're a career changer, they have an online program for career
All right.
changers who want to get a certificate in health information management. And this is learning how to manage medical data. It could be medical charts in a hospital, doctors' charts in their private offices. It could be research medical data. There are a great number of laws in place now that protects that information. It's a very specialized field. It's a certification field, and I would like people to know about that as well.
Absolutely. We've got a caller,
Let's take the caller.
we want to get that caller in before we run out of time. Caller, did you have a question for us?
Yes, I did.
Go ahead.
And the question is, I'm in my third year, actually, at UIC. And my question was that I've just, last spring semester, changed my major from biology to sociology. I'm focused in pre-med to go to med school, and I was just curious of the risks that I'm running doing that, or the pros and cons of doing that.
I love the risk question.
Yeah, the risk question. I can't speak totally for the College of Medicine, but my understanding in general is that all of our programs, not just in the College of Applied Health Science, but across the campus, I think sometimes really welcome students like you who have a broader base of training. Sometimes the complaint with science majors is that they're too focused and they lack the social skills. And in particular, when you talk about urban health issues and the sensitivity needed to work with diverse populations, I would think a degree like sociology that you could very easily defend its broad applications if you went to medical school or any of the health programs.
Sure.
And so I wouldn't be concerned about any risk with that switch.
Absolutely, and one thing that we're hearing from all of the people that we talk to from all of the health science colleges is that the more practical experience that you can get, if you have opportunities to volunteer, if you have opportunities to do research and that type of thing, that those things also go a long way in helping out with your application process.
Yeah, thanks for saying that. Yeah, and the volunteer experience is very important. Volunteering in professions that you might be interested in their offices or in hospitals or clinics, or volunteering in the community, all of those things are very valuable.
Okay, well, thank you so much for your call.
Awesome. Thank you very much.
And we're getting pretty short on time here, so I want to give you an opportunity to say anything else that you think will be helpful to our viewers or our listeners who might be considering one of these careers, or just something else that you want to say about the college that you think is important.
Well, I think we have a great college, but you don't need to hear that from me. I think the more important thing is to have confidence in going forward.
Absolutely.
If you have something that you're interested in, go for it. If you work through the UIC website, there are contact numbers for all of these programs. We all have people who are happy to meet with you, to talk to you about this, to kind of support you in this exploration process. These are wonderful careers. They're all careers that will make you happy for the rest of your working life, and we're looking at 30 to 40 years of being intellectually stimulated and making a good living. They all pay well, and so I would say, if you have an interest, really follow that interest, really pursue it, and let us help you in sorting that out. We're here for you.
Okay, well, thank you so much. We are running short on time, and speaking of letting us help you, for more information about the College of Applied Health Sciences or any of the other health sciences at the University of Illinois at Chicago, anything that the Urban Health Program might be involved in, feel free to give us a call. Our number's there on the screen, as well as our website. And thank you, Dr. John, for being with us here today.
My pleasure.
And thank you for watching Urban Health Hotline.